Thank you, Mr. Chairman. 3 weeks ago, Secretary Kennedy abruptly fired all 17 members of the ACIP, and then he appointed 8 new unvetted members, many of whom are known vaccine skeptics. And as we all know, the committee is starting today to vote on vaccine recommendations. As of last night, they're down to just 7 members. I wanted to ask you, do you agree that any new ACIP members should have to go through a thorough ethics review process before meeting?
The members of the ACIP do need to go through a thorough ethics review before they are allowed to participate in those critical meetings.
So if that ethics review process was not complete before the committee met today, do you think any vaccine recommendations from this week's meetings should be valid?
So my understanding is that to convene the ACIP meetings, there needs to be a quorum of participants in those.
No, I'm asking you about whether, you just said that they should go through the ethics vetting before meeting.
Correct.
They are meeting today without that ethics review process. Should they make recommendations today? Should they be valid?
I'm not familiar whether or not the members that are participating in the meeting this week have or have not gone through the ethics review necessary to allow them to participate in those meetings.
If it is known that they've not gone through the ethics process and they issue recommendations, would you accept them as valid?
If they have not gone through an ethics approval process, they shouldn't be participating in the meetings.
I would agree with that, and I know Chair Cassidy has expressed concerns that about that as well. These affect millions of people. And it's not just the members that I'm concerned about. Secretary Kennedy is bringing anti-vaccine conspiracy theorists from his former organization into that crucial vaccine meeting. Lynn Redwood, who's from the Children's Health Defense, is scheduled to give a presentation on thimerosal and vaccines to further RFK's debunked claims that it causes autism, and she cited a study that does not exist. And after that was pointed out, CDC uploaded a new presentation. But let me ask you, do you think it is acceptable for a known conspiracy theorist who cites made-up sources to be presenting at CDC's ACIP meeting and advising on vaccine recommendations?
So I'm not familiar with the person you've identified. The ACIP is a public meeting.
Yes.
And members of the public are in a position to be able to present what should be scientific and evidence-based information, and members of the ACIP should listen to that information and be able to evaluate the veracity of the data that is being discussed.
Well, the CDC director makes the decision on whether a vaccine should be recommended to the public and does not have to follow recommendations passed by ACIP. What will you do if the committee votes to remove vaccines from the vaccine schedule or to not approve new ones in opposition to clear established science?
So if I'm confirmed as a CDC director, I will be an active listener and will be very interested in the discussions that take place at the ACIP meetings. I will be looking at how the ACIP members are able to evaluate this complex scientific information and the statistical analysis that goes into the risk-benefit associated.
I appreciate the long answer there, but I have to say that many of us are very deeply concerned about the recommendations because they impact millions of people, as I said. But they also translate directly into which vaccines get covered by insurance and which vaccines are then accessible to patients. Secretary Kennedy has spread really blatant disinformation about vaccines and undermined the established science by pretending that families need to do their own research on vaccine safety. Secretary Kennedy recently decided to revoke COVID vaccine recommendations for children and pregnant women, meaning that their insurance may now not cover the cost of their vaccines. Do you think leaving it up to the parents or the individual, if the choice they are left with is to spend hundreds of thousands of dollars just to get one vaccine that was previously free, is the right way to go here?
I think we need to make sure that we are providing transparent and clear, effective communications about the benefits and the risks associated with vaccines so parents can make informed decision-making for themselves, their
Well, it's
children,
hard
their
to
families.
know if it's informed if you have ACIP members who are listening to somebody who's a vaccine conspiracy theorist that has been debunked. And I just want to make this clear. When ACIP pulls its recommendation or refuses to recommend an evidence-based vaccine, a lot more kids and a lot more families will not get vaccinated. They will not be able to afford it. And that is the reality. Thank you, Mr. Chairman.